and that's the model that we followed for development of the prostate center. It's a multidisciplinary clinic, a Kirkland clinic, that brings together urology specialists, radiation oncology specialists, and medical oncology specialists. And this is really for the patient's benefit. It's a one-stop, patient-friendly, user-friendly venue, I guess. This enables the patient who has a complex problem, in prostate cancer particularly, to get multiple opinions and then come to a decision about what's best for their treatment. The team is comprised of specialists in oncology. The specialists span the urology oncology, which is a surgical field, radiation oncology, which is the area that treats patients with radiation usually in the outpatient department of the cancer center, and also the medical oncologists that treat patients with intravenous chemotherapy in the outpatient department at Kirkland Clinic. And so these are the main doctor components of the interdisciplinary team. We have a patient educator who helps facilitate communication, helps get education materials for the patient and their family. We have a sex therapist who helps discuss treatment options related to sexual dysfunction, either as part of the diagnosis or possibly as a consequence of the treatments, and technicians in the clinic that help us with any diagnostic procedures that we might do.
Everything was, I guess, kind of, I'm going to call it self-contained at Kirkland. There was an excellent staff. They greeted you warmly. Everything was taken care of right there. When I got ready to go home from the surgery, everything was provided for me, so I didn't have to rush out and go to the pharmacy. Everything's right there for me. I think because everything was right there on the property, and it gave you a level of comfort and security when you meet people, and the nurses know the problems that exist. They were all professional. They all treated you with all dignity and respect. They didn't sympathize for you because I didn't need sympathy. I needed assistance, and they provided that assistance from the time you walked in to get a urine sample, to the time you went to get a blood test, to the time they actually checked you. Everything just worked out well for me.
Didn't have to go tearing around from one place, from one building to another. We met other doctors, but we weren't just given an appointment to show up at somebody. Dr. Urban, as soon as we decided it was going to be radiation and hormone, brought Dr. Fivash right into the room, and we met and spoke. And Dr. Urban, at that point, excused himself. He said, "Dr. Fivash's hand is down." Oh yeah, it made it much, much better.